Welcome, everyone. We will begin in a moment. Welcome, everyone, to the 8th Annual Your Way Home Summit. Please welcome
everyone.
Commissioner Val
I'm Dr.
Yarkush
Val
for our welcome
Yarkush,
address.
Chair of the Montgomery County Board of Commissioners, and I'm here to welcome all of you to the 8th Annual Your Way Home Summit. Over the past several years, we've come together as a county to end the experience of homelessness for as many of our neighbors as possible. I'm so sorry that we cannot meet in person this year to celebrate the essential and pioneering work of Your Way Home, but I am excited for the opportunity for all of us to connect virtually and have crucial conversations about the challenges we continue to face in ending homelessness in our community. In the early years of Your Way Home, our focus was on making homelessness rare, brief, and non-recurring for as many Montgomery County residents as possible. We incorporated best practices like housing first and rapid rehousing, using limited public resources and building a strong public-private partnership to maximize our impact. Since 2018, Your Way Home has courageously and boldly chosen to put a spotlight on systemic barriers to equitable access to homeless services, outcomes, and leadership opportunities. We've conducted a racial disparities analysis and launched new projects and partnerships that place racial and social equity at the center of everything that we do. We recognize that inequities are deeply rooted and begin long before people become homeless. We're committed to ensuring that once people contact Your Way Home, they are treated with dignity, justice, and fairness. We're already fighting on so many fronts against racism, poverty, violence, addiction, and the affordable housing crisis. And then COVID hit. The pandemic has put all of these challenges into stark relief, revealing them to policymakers and members of the public who may not have been aware of how deeply they impact people across our community. And unfortunately, due to job loss or a health crisis, many of them are experiencing housing instability for the first time in their lives. They are employed or unemployed. They are our teachers, our nurses, our first responders, our small business owners, our delivery drivers, and during the pandemic, they cannot make ends meet. That's why I'm excited to announce that Your Way Home has been working hard to address and prevent homelessness and stabilize working and low-income individuals and families through new and innovative resources, such as the Your Way Home Emergency Rent and Utility Coalition, which aims to provide $6 million in rental and utility relief to households impacted by COVID-19. Additionally, in an effort to support those at increased risk of eviction due to the devastating impacts of the pandemic, I'm very happy to announce that Your Way Home has expanded the incredibly successful EPIC program, which stands for Eviction, Prevention, and Intervention Coalition. It truly is epic. It's now been expanded to 7 additional courts in Montgomery County. These are critical preventive steps during this pandemic, but we cannot lose sight of the fact that the fight for equity across our community is far from finished. We must remain steadfast and committed to our mission. In the spirit of service, please be sure to collaborate today. Remain active and share your ideas. Be sure to network and exchange contact information with others. Collaboration is essential to our success, and it remains a key ingredient to accomplishing our goals. We've made great strides in Your Way Home's mission of improving the housing stability, economic security, and health of people experiencing or at imminent risk of homelessness. Today, we will continue to build on that mission together with commitment and passion. I want to take a moment to recognize the extraordinary dedication and professionalism of our frontline workers, from the Your Way Home call center operators to our incredible street outreach team, to our emergency shelter and housing case managers. We would not be here today without you and the lives that you have saved. Thank you all for joining us today. I know we're not together in person, but we're together virtually. And more importantly, we're together in spirit and with our shared commitment to achieving the goals of Your Way Home and making sure that every family possible has a safe and secure home in Montgomery County. Thanks, everyone, and have a great time today.
Good afternoon, everyone. My name is Joel Johnson. I am the Executive Director of the Montgomery County Housing Authority. I also have the pleasure and honor as serving as the Chair of the Your Way Home Advisory Council. And I'm here to welcome you as well to our 8th annual and first and hopefully last virtual summit. So we have hundreds of people joining us this afternoon, and obviously we're not able to individually introduce ourselves, but we are going to, through the power and magic of Zoom, try to get a sense of who's with us this afternoon. So I think a survey is going to be popping up on your screen. So if you could just indicate which broad category you fall under. Your screen should show the survey now. So if you just punch one of the buttons there and submit, we will have instant survey results. And I think we'll be able to see those in just a moment. So again, we're just trying to get a sense of the various sectors that are with us this afternoon. And do we have the survey results? Here they are. 71% nonprofit or service provider, 15% public government, 5% advocate community member, 1% Your Way Home consumer client participant. So certainly a special welcome to that group. 6% philanthropy and 3% other. So a fairly representative cross section. So our next survey question, we're trying to understand from which part of the region you are coming from. So I think that's going to pop up on our screen in just a moment. You can see the various counties listed there. If you can just fill out your place of residence and submit. I think those results will be popping up in just a moment. Perhaps not surprisingly, about 3/4 from Montgomery County, but we do have a good representation from Bucks, Chester, Delaware County, Lehigh, Philadelphia, and 2% other. So again, thanks for your participation in that. And we have one more survey question. I think we're going to turn it over to Sheldon Good, who is Your Way Home Program Coordinator, for a question relative to what folks are hoping to get out of today's summit.
Yeah, thanks, Joel. So please enter in the chat your response to this question. What do you hope to most get out of today's Your Way Home Summit? Feel free to respond in the chat. What do you hope to most get out of today's Your Way Home Summit? So Joel, I'll reflect back a couple that I'm seeing here. Collaboration and coordination, ideas on helping people who are housing insecure, meeting new people, new resources for families and collaboration, better understanding of the county's housing resources and what current needs are, better understand how the pandemic has affected homelessness in Montgomery County, updates on successes and challenges from the last year and our priorities moving forward. They're just rolling in. There's dozens and dozens of them here. It's great. Inspiration to continue this excellent, desperately needed work. So those are just a few.
Great. Well, Sheldon, thank you so much for leading that effort. Obviously, we have great enthusiasm from folks participating this afternoon. And in just a few minutes, we'll be, or just a few moments actually, our very special keynote speaker, who happens to serve as a visiting senior fellow at the Center on Budget and Policy Priorities, Miss Oliva, will be joining us, and she'll lead us in a fascinating discussion and presentation. And be sure to stick around following our keynote. We have a series of 9 breakout sessions that cover a wide range of topics that I'm sure will be informative and useful to help address some of those interests that Sheldon described. And just a technical point, if you did not happen to pre-register for a breakout session, don't worry. Again, through the power and magic of Zoom, you'll be automatically assigned to one of the breakout rooms. So just a little more housekeeping points. We certainly have plenty of opportunities for questions and dialogue and networking this afternoon, but when the presentations are going on and you're not speaking, if you could please keep your microphone on mute, but keep your video camera on if you are able, we would appreciate it. Following the breakout sessions, we have 2 awards. One, the Champions for Change Award, and the second, the Meredith Huffman Award. So please stick around for those. So again, thank you for attending this afternoon. We hope everyone has a wonderful experience. I'm now going to turn it over to my friend and longtime colleague and one of Your Way Home's founding partners and supporters, Mr. Russ Johnson, who is the president and CEO of the HealthSpark Foundation, to introduce our keynote speaker. Russ?
Thanks, Joel. Thanks, Kaylee. Thanks to Commissioner Arkush for her continued support as leader in Montgomery County and advocate for housing and supportive services. I am Russ Johnson from HealthSpark Foundation. This is, I believe, my 8th summit that I've had the pleasure to be part of, and it just brings me joy to be part of it every year. But I have the honor this afternoon of introducing our keynote speaker. As Joel said, the team at Your Way Home was successful in inviting Oliva to be our keynote speaker. Could not have invited a more influential and thoughtful leader in the field of housing. So Oliva comes to us, as you heard, as a visiting senior fellow at the Center on Budget and Policy Priorities. Prior to that, she was at Corporation for Supportive Housing, where she had been the senior policy advisor to the chief executive officer since 2018. Prior to that, and many of you may know her in this capacity, she was Deputy Assistant Secretary for Special Needs at the U.S. Department of Housing and Urban Development, where she oversaw a multi-billion-dollar portfolio that included the department's work on homelessness and housing for persons living with HIV and AIDS. During her tenure at HUD, she successfully designed and implemented a variety of initiatives and programs, including a $1.5 billion homelessness prevention and rapid rehousing program funded through the Recovery Act and a demonstration to end youth homelessness. At the community level, she has worked as Director of Programs at the Community Partnership in Washington, D.C., and earlier she started her career as a VISTA volunteer in the Women's Housing Coalition in Albuquerque, New Mexico. In 2015, Ms. Oliva was named as one of the 50 most influential leaders in HUD's 50-year history and was honored with the True Colors Fund True Leader Award. She was the finalist for the Samuel J. Hyman Service to America Medal in Management Excellence in 2011 and was part of an interagency team that won a Sammy for the team's work on reducing veterans' homelessness in 2012. Ms. Oliva has a degree in politics, philosophy, and economics from the University of Pittsburgh. And if you haven't heard and caught up with her, she's a frequent blogger. And just today, posted yet another blog in response to the USICH announcement yesterday about the new priorities that the administration is advancing. So be sure to read that blog. But without further ado, please welcome Ms. Oliva.
Thank you so much. I'm going to have to cut that down a little bit because it's a little embarrassing to listen to somebody introduce me. Thank you so much for having me. I'm really excited to be here with you all today. I have not only worked with Montgomery County over many years in a variety of different ways, but I'm actually from the Philadelphia metro area. I grew up in Delaware County, went to Haverford High School. So it's, although in normal circumstances, I would have just stayed at my sister's house to see you in person. It is really, really nice to be here with you today. So I'm going to share my screen because we have a lot to talk about. And let's see, let me make sure I get it. There you go. Can you all see my screen? Great. So we have a lot to talk about today. And again, I'm excited to be here just because we're in this place right now in housing and homeless services that is so, so critical. And I was actually just talking to the team that put this summit together and saying that in a lot of ways, you know, there's a lot of things that have been really concerning, especially for somebody like me, who's a former federal official. There's lots of things that are concerning in terms of policy and priorities and budget. But what is also really invigorating and really exciting is sort of the energy of the housing and homelessness sector and what we've been able to do together and bring together over the last several years in an environment that hasn't been super welcoming to, especially to the folks that we serve. So today I'm going to focus on some of the things that I get excited about in this work and that I think are really important for us to talk about right now. But before I get started, I just wanted to say one other thing about my own work that I think is important and that I'll sort of pepper in as we talk over the next few minutes. And that is that one of the reasons that I left the Department of Housing and Urban Development, I was a career employee there. Even though I was a deputy assistant secretary when I left, I was a career staffer. I actually worked in 3 administrations for 5 different secretaries. And one of the reasons that I decided to leave after 10 years of federal service was that I felt like I didn't know anymore how the policy decisions that I was making or impacting people in the field, and especially people who are serving people experiencing homelessness and people experiencing homelessness. So over the last 4 years, I've had an incredible opportunity to do talks like this and be in community with folks. And I've done in-depth work in places like San Diego, Houston, Texas, after Hurricane Harvey, the District of Columbia, King County, Los Angeles. And for the first time in a long time, folks tell me not just what they think I want to hear as their funder, but the actual challenges that they are experiencing. And that is influencing the way I approach my work. And I hope that for you all, that comes across today. And I hope that you carry that in your own work as well, whether you're a government official or whether you're a nonprofit service provider, because really understanding how our decisions are impacting people with lived expertise or people who are experiencing homelessness right now and our frontline staff really is incredibly, incredibly important. So it's one of the things that, one of the joys of having been in the field for the last 4 years is really being able to learn that. So the 3 big buckets of information that I want to talk about today and where I want to orient our discussion is around using a racial justice and equity approach and what that means and why I use those words, identifying what your plan should be and what interventions, and I'm going to focus a little bit on the front door to the homelessness assistance system in today's discussion, but there's a lot of ways that you could take what I'm going to talk about and apply it to other parts of the system. And then I want to give you an idea of what we might be aiming at and what we might see coming down the pike in the future. But if you've ever heard me speak before, or if you've heard me, if you've read one of my many blogs or follow me on Twitter, you know that I always start with the data. I think it's an important place to ground yourself in what's happening. And I'm just going to talk about the national data just a little bit so you can see how I'm orienting the rest of this discussion. And this data always tells us where we are. It is not the whole story, but it is a good start. So here on this slide, you'll see that this is our point in time data. I'm sure you've seen it many times before. Even though I left HUD, I still rely on this point in time data just to give me the broad stroke trends of what's happening in the world of homelessness right now. And this runs through 2019. HUD hasn't published the 2020 data yet. But you can see generally what the trends are. The blue line is all people who are experiencing homelessness at a point in time across from 2007 to 2019. The gray line is people who are in sheltered situations. So that's emergency shelter and transitional housing. And I want to draw your attention for a moment to the green line, because this is a place where I think we need to pay a lot of attention. And that's because if you look at that green line, you can see that since 2015, the number of people in unsheltered locations counted at a point in time in the last week of January of every year has been going up. And in places like on the West Coast, it is incredibly visual. There are a big uptick in encampments and people in cars. There's things called safe parking now, where people who are living in their cars can go and be safe. And that's something that we didn't really even contemplate a number of years ago. So I think that that's an important place for us to start our discussion and really have that in the back of our minds as we're thinking about how we want to move forward in our work. And then the last thing I'll say about this is, even though the 2020 data from HUD is not yet out, I've scanned enough communities who have posted their point in time data to know 2 things. Unsheltered homelessness in 2020 has continued to rise, and that was pre-pandemic. So in 2021, I think that we're also going to see some pretty stark indications of how the pandemic has impacted people experiencing homelessness and housing instability. Then the other thing I'm going to point to that's not on this chart, but that's important, is that the number of people who are experiencing chronic homelessness in the communities that I've looked at has been increasing pretty steeply over the last couple of years, and I expect to see that continue in 2020. But as I said, the one night count is only a portion of the story. And when you look at homelessness over the course of a year, you see something slightly different. And as you can see in this chart, about 1.45 million people experience sheltered homelessness over the course of a year. So we have a lot of flow in and out of the homeless assistance system. And about 35% of those people are people in households with children. And the vast majority are adult-only households. So we do see a lot of flow within the system that we need to take into account as we're doing planning. And so now we know how many people are in our system nationwide at a point in time, and how many people are sort of flowing through the sheltered portion of our system over the course of a year. But it's also incredibly important to make sure that we understand where people are coming from into our system. And over the last, I would say maybe 10 years, and really specifically over the last few years, we really have started recognizing that homelessness is a symptom of dysfunction in other systems that really should be designed. Those systems should be designed to protect people who are marginalized, or who are living with disabilities, or who are in foster care, or have behavioral health issues. And what's happening is that a lot of people are being exited from those systems, either directly into homelessness, or people who are experiencing homelessness have experiences within those systems. So for example, about between a quarter and a third of youth and young adults have a history of foster care involvement. So we know when we talk about systems transformation, we're not just talking about the homeless assistance system. We are actually talking about system transformation that has to cross a number of what I will use the terminology mainstream systems in this discussion today, but it has to cross all of those places, because we know that those, without reform and ultimately transformation of those systems, we're actually not going to be able to fix the homeless assistance system in order to meet their needs. So between a quarter and a third of youth and young adults, history of foster care involvement. People who were formerly incarcerated are nearly 10 times more likely to experience homelessness than people who are in the general public. And over the course of a year, we know that almost half of the heads of households and other adults within our system are living with some form of disability. And again, what that points to when we're thinking about data and we're thinking about our baseline, what that points to is this really strong need to collaborate and work with other systems in a way that doesn't put the onus on the homeless assistance system to ensure that there is housing for people exiting those systems, but really ties housing to those systems in meaningful ways so that people can be diverted or prevented from becoming homeless. And we're going to talk about that in a minute. And I don't think that there's any conversation that folks are having right now. And I've read your own materials about how your community is working on a racial justice and equity approach and the steps that you're taking. So one of the things that was included, I think, in your sort of top 10 list is really about examining data, but I will actually go a little bit further. I think it is incredibly important as we plan for systems transformation that we are actually disaggregating data at every level. I had the opportunity to write the strategic plan for King County for their homeless services system. And one of the things that changed for King County during the process of working on this project was all of their public data dashboards are disaggregated by race and ethnicity. And that way folks can have a really informed discussion about how people of color and communities of color are impacted by homelessness and housing instability and can actually see it all the way through the system. So that's a concrete step that you all in your programs and in your community can take to really move down the road towards racial justice and equity. And this data up here really just brings home that the environment that we're living in right now and that we're working in right now around COVID-19 and the intersection between COVID-19 and housing instability and homelessness is really, really stark for communities of color. We know that communities of color are disproportionately impacted by both the virus itself, so they're disproportionately impacted by becoming ill at higher rates, and they are disproportionately impacted by the economic impacts of COVID-19, in large part because Black, Latino, and immigrant workers are likelier to work in industries that pay low wages, where job losses have been larger than in higher paid industries. And all these disproportionate impacts really reflect a set of harsh inequities stemming from structural racism in education, again, cross-system, education, employment, housing, and healthcare. So we know that COVID-19 has these disproportionate impacts, but we also know that homelessness is disproportionately impacting people of color. Black people accounted for 40% of people experiencing homelessness, although they only make up 13% of the US population. Latinx people make up 22% of people who are experiencing homelessness, but only 18% of the population. And that disproportionality actually also carries over into the American Indian, Alaska Native communities, but the data is just much harder to get on those communities for a variety of reasons, including that many funding streams can't actually serve people on reservations. And so that is a structural inequity that, that needs to be addressed as we go forward. And then the last thing I'll say about the data is you always sort of have to have your eye on what's coming next. In the homelessness assistance system, as you all know as well as I do, that we aren't actually creating homelessness. Homelessness is being created by these other factors within our environment. So we always have to have an eye to what is coming down the pike in order to calibrate our systems to be able to work in the best way possible. And these are just two examples. The Center on Budget and Policy Priorities, we are a progressive think tank, and we produce a lot of writing and a lot of data. And these are just two charts that the center has posted over the last couple of weeks, where we can see that nearly 1 in 6 renters is not caught up on rent, which means that we have the potential when the CDC eviction moratorium or local moratoria ends, that we could see an avalanche of people being evicted from their housing and potentially ending up in the homelessness assistance system. And the data shows us that Black, Asian, and Latino renters are facing the greatest hardship. And then the chart on the right is about food insufficiency. And you all know, again, as well as I do, that a lot of times what happens is that idea of being caught up on rent is a little bit misleading, because in a lot of households, the rent eats first. So people will pay the rent in order to stay in their housing and go without other very high priority items like food, and you know, they won't pay their utilities, or they won't pay their insurance payments, or you know, other things just have to get put aside. So you actually have to look at the number of people who are not caught up on rent in addition to other types of factors. And the chart on the right tells us that Black and Latino households are likelier to be experiencing food insufficiency during this pandemic. So what this really points to as a set of solutions or interim steps that we need to take as a community is to look down the road, make sure that we are using a racial justice and equity lens in our work, so that we are prioritizing the people that are most likely to be disproportionately impacted by this situation and by homelessness in general. And we also need to ask people what they actually want. And this is part this idea of asking impacted people what they want and need is a key part of having a racial justice and equity approach. Because again, the data tells us that communities of color are disproportionately impacted by COVID-19, by housing instability, and by homelessness. So when we design solutions to these challenges, we need to make sure that we're actually asking people who are impacted what they want and need. So I want to just note this for a moment. I get to work on a variety of different projects these days. And one of the projects that I've been working on for the last 6 months is a project called the Framework for an Equitable COVID-19 Response. It's funded by a number of philanthropic organizations, and it has brought together a number of experts and national organizations in the field, including the Urban Institute, the Center on Budget and Policy Priorities, the National Innovation Service, the National Healthcare for the Homeless Council, the National Alliance to End Homelessness, and 2 former USICH executive directors, Barbara Poppy and Matthew Doherty. So we have gotten together and come up with this framework to help people really focus their COVID-19 response, do so in an equitable way, and really use their data to help figure out the best way to use federal funds that are coming down the pike. In that, because we wanted to use a racial justice and equity approach, we actually started by asking impacted communities. So the National Innovation Service conducted 11 focus groups in June with people who have lived experience of homelessness and housing instability and are in communities that tend to be marginalized within the homeless services system. So the list is up there on the screen. But I think the most important piece to this work is what they told us. And what they told us were across all of those 11 focus groups or listening sessions, they told us 4 things that cut across. So these themes are really what we're oriented towards in our work in the long run. So just to note, this is sort of the second concrete action that I am suggesting to you all. Make sure that you are partnering, not just a one-time focus group, but actually partnering with people with lived expertise to help you continually design and improve programs. So here are what the 4 things that these folks told us. The first is we need to fundamentally reimagine what emergency shelter looks like. People were very clear with us. Not only does sort of a warehouse approach not work in a pandemic, which is what we've seen since March of this year, but it actually isn't the kind of approach that they want, and they feel like it's inhumane. So can we, as a community, really look at what emergency shelter means and reimagine that in partnership with people with lived expertise? The second thing is, can we do more to build, support, and fund dignity-based services? If anybody on this, in the summit today follows me on Twitter, you will know that I posted a fairly lengthy tweet thread the other day in response to the new USICH document on the Federal Strategic Plan to Prevent and End Homelessness. And one of my really big criticisms is that we have moved away from the values of serving people and treating people with dignity. And what number 2 here on this screen of what impacted communities are telling us is to use our dollars to work with them to build, support, and fund these sort of dignity-based services that will help them end their experience of homelessness. The third, again, is really to develop more affordable housing, which we all know needs to be done, but really to focus and target that housing first to the communities that are most impacted by structural inequity. And we're going to talk about that in just a minute. So I'll come back to that. And then the fourth one was around, again, being treated with dignity. And that is removing police from our frontline response to homelessness, especially around outreach, and to stop criminalizing people who are experiencing homelessness because they have nowhere else to sleep at night. So what cuts across all of those themes is that people want to be treated with dignity and with respect. And none of those things are going to be easy for us to reach, but while we're trying to get to them, hopefully we can continue to infuse dignity and respect into our interventions. So once you look at the data and talk to people who have been impacted by homelessness and housing instability, then you can design and fund interventions that will work for both your community and for people who are experiencing these challenges. And this is really just an example of one way to think about it. This is a document that's called the At-a-Glance Matrix. It was released as part of this framework for an equitable COVID-19 response. And here's what it does. It breaks the design and funding process into 4 major steps. One is, do you have people who are sleeping on the streets and in other unsheltered locations in your community in high numbers or in low numbers? If it's in lower numbers, there might be one set of approaches that you want to take. If it's in higher numbers, you have a different set of approaches that you want to take. Then the second is to really identify what the total need is within your community. So what are the kinds of interventions that people who are experiencing homelessness and housing instability need in your community? So I list them all out. And then third is to identify all the funding sources that you have and start to plug those in to the right types of interventions. So what we suggest here is to take the most targeted types of funding that you have, for example, emergency solutions grants, COVID money, and use those for the kinds of things that only those funds can be used for. So for example, that funding needs to be used for people who are experiencing homelessness and for prevention. So make sure that that is going to your shelter response, for example, and then use broader sets of funding to fill in the gaps, like your CDBG, Community Development Block Grant funding, or coronavirus relief funds. And then fourth, also figure out who has been left out of that plan. Is it people who are experiencing housing instability or are at higher income levels? And then identify what partners you need to have in place in order to address those needs. So I'm going to focus for a moment, as I mentioned before, on sort of the front door of your system. I think that the approach that I just talked about and that we're about to talk about can actually be applied to a number of places within your system. But for the purposes of today's discussion, I want to talk about diversion, homelessness prevention, and eviction prevention. And here is the way that the National Alliance to End Homelessness defines diversion. So it's an intervention designed to immediately address the needs of a household that has just lost their housing and become homeless. So it's really client-driven. It's often referred to as problem solving. So can you get somebody back into, I know in Washington, D.C. we did a lot of mediation between parents and in the family system, between parents and young parents, their kids who also had kids. Is there any mediation that can be done? Can we figure out some alternative housing immediately and really divert people from the homelessness system through problem solving? Oh, and I just want to note, one of the best programs I have ever seen around homelessness diversion was again in King County, and it very specifically took a racial justice approach by using philanthropic dollars to build capacity for smaller organizations that would never have gotten government money under regular RFPs or notices of funding availability. They wouldn't have met the capacity requirements. But what this program did was build capacity within those small organizations that really know their community, that their community members trust, that can mediate between family members. And they put diversion funds into those organizations in highly impacted communities where a lot of people were entering the homeless services system from. And the extraordinary part of that program was just how well they were able to keep people out of the homeless services system for very small investments of dollars. And then for the purposes of today, we're also going to sort of bifurcate a little bit prevention into homelessness prevention and eviction prevention. And this is where it starts to get a little bit more complicated. When we're talking about homelessness prevention, we're really talking about targeted rental assistance and arrears, services like mediation, legal assistance, sometimes moving assistance. And we know that a previous episode of homelessness is the strongest predictor of another episode of homelessness. So when we're talking about homelessness prevention, this is really targeted to people who, without that assistance, would likely become homeless. And we're also talking about upstream work with other systems to prevent discharge into homelessness. And then when we're talking about eviction prevention, we're really talking about ways to stabilize families and individuals in community. So right now that looks like eviction moratorium plus arrears, payment of arrears in a lot of communities. It can target some higher income households. And when I say higher income, I really am talking about maybe between 50 and 80% of the area median income. It often looks like legal assistance to help keep people in their housing. And I want to note that sort of before implementing an eviction prevention program, really communities need to look at their entire system and figure out where eviction prevention fits in their larger housing strategy, not just their homelessness strategy. So by using a racial justice and equity approach to homelessness and eviction prevention, as well as to diversion, we can actually start to address some of the harm that has been done by racist policy in the past. And I want to bring your attention to these two communities. We actually did, as part of the framework for an equitable COVID-19 response, we worked with the Urban Institute to develop a tool. It's online. I'll put the link in the chat to help folks target their prevention assistance based on a number of indices. And those indices include housing instability. So that's the share of people who are living in poverty, who are in renter occupied housing units, or who are severely cost burdened, combined with a COVID-19 impact index, which really is about like how many people don't have health insurance, how many low-income jobs were lost, and also combined with an equity sub-index, which is about how many people are in low-income renter households, how many people are receiving public assistance, how many are people of color. So when you look at all of these, the darkest places on these maps are the places that have the highest need. So if you are working on diversion or homelessness prevention or eviction prevention, we really think that you should be targeting these census tracts in communities in order to have the biggest impact, because those are the folks that are most impacted by these factors: housing instability, COVID-19, and racial inequities. When we posted this on Twitter, we started to get back feedback from communities all over the country that said, oh my God, I'm looking at my community's map, and when you overlay our historic, the maps that show historic areas who are subject to redlining, they're exactly the same. So you can see how we can use our homeless assistance funding and eviction prevention funding to start, it won't fix it altogether, obviously, but to start to undo some of this harm in the past by investing in these communities that have been subject to historic redlining, restrictive covenants, and disinvestment. So I just want to bring up your map. And I know it's probably a little bit hard to see, but this little tiny yellow spot right in the middle is the place in Montgomery County, Pennsylvania, that is the darkest blue. And it is Census Tract 203902. I'm not sure what that neighborhood is called, but it is the highest need neighborhood within your county. And you can see on the right side, it is actually in the 96th percentile among census tracts within Pennsylvania in terms of need. And you can see it's in the 93rd percentile for housing instability, the 97th percentile on COVID-19 impact, and the 95th percentile on your equity subindex. So I would encourage folks to think about this part of your system and all parts of your system in this way, because you can see that what I'm getting at is a racial justice and equity approach can really have an impact, not just on the immediate challenges that we're trying to solve, but in the long term as well, as we start to invest in communities that have a historic level of disinvestment. And then another way to think about this, and I'm not going to spend a ton of time here, I'll put the link in the chat, is to think about prevention within every portion of your system. This is from the Canadians. I like to look at what the Canadians are doing because they do have some fundamental differences from what we do, especially around healthcare. But what this tells us is that you can actually incorporate prevention into every level of your thinking. So the first is really structural. Universal basic income, that is a structural prevention mechanism. Housing is a human right, structural prevention mechanism. So we're not just talking about where we put our dollars today, but what we're trying to aim at in the future. The second one is systems prevention. We've talked about that. That is working with mainstream systems and collaborating across systems to make sure that people aren't being discharged into homelessness. The third one is, again, early interventions. What do interventions like diversion and homelessness prevention need to look like in your community, and who should be targeted for those resources? The fourth one is broader evictions prevention. What financial assistance and mediation resources should be part of your housing ecosystem in order to help people maintain stability? And then the last one there is, again, how do we maintain housing stability in the long run? And for people who have experienced homelessness and for people who haven't. And I would argue that maybe this isn't a line. This shouldn't be actually depicted as a line up or down, but it's really a circle. Because when you are supporting people through structural prevention activities, you are actually supporting housing stability in the long run. So here's my call to action for you all. As homeless service providers, we need to both act on what we need to do now, and then keep our goals and the vision of systems transformation in mind so that we're always moving and making decisions towards housing justice. So here are some of the things that you can do now to reform our systems. And you can use your COVID-19 funding to do that. Institutionalize racial justice and equity practices. You all are moving in that direction based on the documents that I've read at a quick pace. Keep doing that. Create real partnership, not tokenized input, real partnership with people with lived expertise. Strengthen your partnerships with non-traditional groups like those small community and neighborhood-based organizations that I talked about, and other systems. Create and implement those dignity-based services. Think about what shelter and outreach can look like in a better world. Target your prevention resources and consistently evaluate your outcomes and implement those corrections that you need to implement. And I love this particular way of thinking about systems transformation. Back in the day, some of you might be old enough, I certainly am, that I had a Sony Walkman. And the business world took that idea and kept trying to like make it better, but by tinkering around the edges. So some of you might remember that they went from a Sony Walkman and then they made it like waterproof. And then they went from the waterproof version and then they made this like CD version, which was terrible because CDs skipped all the time. And it was because people were trying to reform the thing that they had in front of them instead of reimagining what listening to music on the go looked like. And when somebody thought, I'm not going to even try and just reform the Sony Walkman, I'm going to think about what it means and how we can better listen to music while we're in transit, they came up with an iPod. Now the iPod is gone too, so that has been improved. But I would really encourage you all to think about what we're doing, again, both by doing the things that we need to do right now, but also with an eye towards that system transformation. And I think that we can move from, again, the sort of top part of this graphic, which is where we are now. We have a small prevention system, we have this huge emergency response system, and then we have a small set of accommodations and supports for folks, to something that really looks more like justice, which is a large prevention and a large accommodation and support system, and emergency response only for those people who fall through the cracks. And that looks like racial justice and equity. That looks like universal housing vouchers, and healthcare for all, and services to support housing stability in the community. And what I want to leave you with is this. Ending homelessness isn't going to be possible without housing justice. And we have a responsibility to sort of create an environment and a nation where everyone has access to the supports they need, and where housing can be a human right. And we need to move from the inequality that we currently live in to a justice-oriented system. And this is actually the best depiction using the giving tree as a base to think about moving from inequality to equality, which is what we used to strive for, but actually not what we want, to equity, but then really into justice, where we're actually fixing the systems and doing systems transformation so that everybody has access to what they want and need to be stable. Thank you so much for having me. I'm not sure if we have time for questions, but I'm happy to take them if you all think we have time.
Thank you so much, Anne. That was excellent. And yes, we do have a couple of minutes here for questions. We'll take a few. Thank you for sharing them in the chat. So Anne, one of the questions was, is there any conflict between building affordable housing in communities impacted by homelessness and the desire to further fair housing and helping people to live in all zip codes versus just a few?
Yeah, I think, this is something that is coming up a lot in these discussions, so thank you for raising it. I think that to some extent, we need to really focus on, and when I say communities, I don't always mean neighborhoods. I actually mean people. So we can make sure through a comprehensive approach that we're building housing in a variety of different communities so people have the choice to decide where they live. So fundamentally, we need to make sure that people have choices. But also when we are targeting those resources, targeting them to people who have been historically subject to marginalization historically can be one way that we try to work our way towards housing justice. So I do think that there's a little bit of tension there that needs to be resolved, but I also think that there's lots of people right now in the field that are thinking about those tensions and working out how you can do both.
Thank you so much. Another question was, how can we connect the data and the ideas that you've been presenting here to opportunities for advocacy, whether at the federal, the state, the local level? So connecting what you've presented here to opportunities for advocacy.
Yeah. So the reason that I presented the data in the way that I did is because most of the time when I'm doing advocacy, I'm doing it at the national level. But a lot of this data is also available at the state, at regional and local levels. So you could actually take this presentation, which I'm happy to share with folks, and sort of identify and disaggregate data in the ways that make the most sense for the audience that you're talking to. I am a big proponent of making sure that you know your audience and what's going to move them, and not just using data by itself in the absence of humanizing the challenges that we are trying to solve for and listening to people who have experienced or are experiencing those challenges. So a lot of these data sets are available on the center's website, broken down by state and some by locality. The Urban Institute tool, you can use that. That goes down to the census tract level. So I think that you can take the same approach that I am at the national level and connect it straight to the policies that you want to promote.
Thank you, and I'm going to combine two questions here. Okay. The first part of the question refers to the best way to continue to respond to narratives that push non-housing first approaches. And the second part of the question, somewhat related, is suggestions for responding to messaging around the suburbs and the need to, quote, save the suburbs. So ideas around how to respond to the messages of that kind.
So there's a couple of people that I think are doing a particularly good job there. I'm not sure if folks are familiar with Mark Horvath. He runs the website Invisible People. And his Twitter handle is Hardly Normal. He comes from, he's awesome to listen to. He does a lot of work around communications and what messaging works around homelessness, because I mean, a shortcoming of our field, I know I do it, is that I tend to want to go straight to the wonk. I want to go straight to like the data and the wonkiness of why I'm right. And that doesn't actually resonate with the public. So I would actually look at his Twitter feed and see what he's doing. He really humanizes the issue of homelessness. He comes from a faith-based community orientation and understands how to use that orientation to be helpful rather than the way that it's currently being used now by the U.S. Interagency Council on Homelessness in particular. And I would say, you know, on the issue of the suburbs, the rhetoric around save the suburbs, I think that's really based on a notion that the suburbs are somehow not integrated, or that there's something that maybe existed in like 1950 but does not exist in the same way anymore. So make sure that you have data about what suburbs you're talking about, and follow Mark Horvath on Twitter, or check out his website, Invisible People.
Thank you so very much, and it's a pleasure to have you with us, and we are very grateful for all that you've shared. So turn it over to Kyle.
Thank you so much for having me. Really appreciate it.
You're welcome. Yep, thank you. Kyle will introduce the breakout sessions.
Hello, everyone. My name is Kyle Tribble, Community Relations Manager for Your Way Home. I would like to say again to second Sheldon, thank you so much, Ann, for your participation and all the great information that you presented. We also want to thank you for your service in this fight against to end homelessness. Now, as Sheldon has mentioned, it will be time for breakout sessions. If you have registered for a breakout session, you will be put in that room that you registered for. In the event that you did not register, you will randomly be put into a room. So I guess we can begin now for the breakout sessions. Hope everyone enjoys.